Rogaine 2% topical solution, also known as Minoxidil, is used to help promote hair growth in men with male pattern baldness. It is not intended for use on the front of the scalp or receding hairline. This solution can also be used by women with thinning hair. Minoxidil is a vasodilator, but it's not completely understood how it promotes hair growth. It's important to note that this medication is not for sudden or patchy hair loss, unexplained hair loss, or hair loss after giving birth. And it should not be used by anyone under the age of 18. For best results, apply the solution to the scalp twice a day, with at least 8 hours between applications. Remember, it may take some time before you notice any hair growth, so be patient and consistent with your usage. Before using Rogaine 2% topical solution, make sure to read and follow all directions on the product package. If you have any questions, ask your doctor or pharmacist for guidance. To apply the solution, make sure your scalp is clean and dry. Fill the applicator with 1 milliliter of medication, or use 20 drops, and apply it to the thinning area of your scalp. Gently rub it in and allow it to dry completely before using other styling products or going to bed. If you're using the foam, rinse your hands with cold water, dry them well, and apply about 1/2 capful of foam to the scalp. Allow it to dry completely before styling your hair or going to bed. If you experience scalp irritation, avoid using the medication on the same days that you have your hair colored or chemically treated. It's important to use this medication regularly for 4 months to see a benefit. It must be used continuously to maintain hair growth. If your condition does not improve after using this medication for 4 to 6 months, or if you think you may have a serious medical problem, tell your doctor. Some common side effects of using Rogaine 2% topical solution include burning, stinging, or redness at the application site. If these effects persist or worsen, it is important to contact your doctor or pharmacist. It is important to note that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Most people using this medication do not experience serious side effects. Rarely, this medication can be absorbed through the skin and cause side effects. If you experience any serious side effects such as unwanted facial/body hair, dizziness, fast/irregular heartbeat, chest pain, or difficulty breathing, it is important to stop using the medication and contact your doctor immediately. While a serious allergic reaction to this drug is rare, it is important to seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects not listed, it is important to contact your doctor or pharmacist. It is important to call your doctor for medical advice about side effects. In the US, you may also report side effects to the FDA at 1-800-FDA-1088. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before using Rogaine 2% topical solution, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that could cause allergic reactions. If you have any scalp diseases, heart problems, kidney disease, or liver disease, it's important to consult with your doctor or pharmacist before using this product. If you are pregnant, only use Rogaine 2% topical solution if it is clearly needed, and discuss the potential risks and benefits with your doctor. It is not known if this drug passes into breast milk, so it's important to consult with your doctor before using it while breastfeeding. Always follow the recommended dosage and timing for best results. It's important to be aware of potential drug interactions with Rogaine 2% topical solution, as they could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Rogaine 2% topical solution include drugs for high blood pressure, such as guanethidine, and drugs that interact with alcohol, such as disulfiram and metronidazole. Be sure to discuss any concerns with your healthcare provider. If this medication is swallowed, it can be harmful. In case of an overdose with serious symptoms like passing out or trouble breathing, it's important to seek medical help immediately. You can call 911 or a poison control center for assistance. Overdose symptoms may include dizziness, drowsiness, fainting, and flushing. Make sure to keep all your medical and lab appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. It's important to stay on top of your appointments to ensure the best results from using Rogaine 2% topical solution. If you forget to use Rogaine 2% topical solution, just wait until your next regular application time. Don't use extra to make up for the missed dose. Make sure to store Rogaine 2% topical solution at room temperature, away from heat. Remember that this product is flammable, so keep it away from fire and avoid open flames after applying it until the medication has dried completely. And as always, keep all medications out of reach of children and pets. When it comes to getting rid of this product, make sure not to flush it down the toilet or pour it down the drain unless you're specifically told to do so. Instead, properly dispose of it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for more information on the proper way to get rid of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.